Hello people, this is Katie Kleber here. We're getting started with our second video about how new nurses, tips for you guys to communicate with the healthcare team. Mac has joined me. He's really grumpy. He wants to leave the room, but I know if he leaves the room, he'll go bark and wake up my daughter. No bueno, right? So Mac is hanging out with us. So let's dive in. I want to talk about some things to kind of help you guys chat with these healthcare team members. So I think one of the first most important things is to understand what each person really is expecting from you. Okay, so you're the brand new nurse. You've got a physical therapist coming up to you asking you for an update. You've got an occupational therapist asking for an update. Well, what does that really mean when they want an update? Like, you know what you're telling your nurse-to-nurse report. You pretty much know what you tell a physician when they're asking for an update. But what about these other people? So let me just kind of dive into what they want. So the physical therapist cares about how the patient is getting up. Okay, if they've gotten up, how much help they need. If they're in bed, how much help are you providing them when you're turning them? Are they getting out of breath? How are they doing hemodynamically? Do you have them on a bunch of drips? Are they having low blood pressure today? Like those kinds of things, anything that would impede them from being able to participate in care from a physical therapist. Because the physical therapist cares about providing an assessment to see where the patient is, coming up with goals, and then coming in every day or every other day or whatever it is to say, hey, let's see where you were last time and progress you. It's very similar to the nursing care plan and the nursing process, but it's the physical therapy perspective. Occupational therapy, very similar, except it's more from an activities of daily living standpoint. They want to know things like are they brushing their own teeth? Are they washing their own hands? Are they wiping themselves when they go to the bathroom? How much assistance are you providing? Because the physical therapist needs to get a baseline and provide exercises and things to get them to take as much care of themselves as possible. So when those people are coming up to you asking you for updates, that's what they're looking for. Speech therapist is same kind of mindset, but on safe swallowing and language and speech. I dealt with speech therapy a lot as a neuro ICU nurse because a lot of brain injuries impair your ability to speak appropriately and swallow appropriately. So if you have a stroke patient, chances are you're going to be working with a speech therapist. They want to know if the patient's handling their own secretions, if they're coughing a bunch, if you're worried about silent aspiration, are they eating okay, are they coughing when they eat, and then that's the kind of mechanical safe swallowing side. The other side is the language side, that can they speak appropriately, can they understand what's being told to them, and are they able to articulate what they want. Receptive, expressive, and global aphasia. That's kind of what they're assessing and giving exercises to, work on to improve. So that's the therapy side. The case management, social work, chaplain side, I'm going to kind of bunch them together too. When they come and ask you for an update, they're kind of looking more of the emotional climate of the patient's room. Like, is the patient, how are they doing? How is the family doing? Who's the support system? How are they working together? Is this a healthy relationship? And, is next of kin, healthcare power of attorney, that kind of stuff. The case manager is really looking at it from a big picture discharge. How are we getting you home? Like, how are you going to take care of yourself at home? If you're not going home, where are you going? What's the most appropriate thing? Social work, they're a little bit more focused on things that are, is there abuse going on, safety concerns, financial concerns, that kind of stuff, child care concerns. And then the chaplain, y'all, love me some chaplains. I think one thing a lot of people don't realize is a chaplain is not there to just convert somebody to their religion. Chaplains are there to provide support to people experiencing crises, okay? So they're there to kind of help people process. A lot of them are trained counselors, which is wonderful. So when you ask a patient, hey, do you want to see the chaplain? Or the chaplain comes by and it's like, well, they haven't talked about God, so I don't think they want the chaplain. It's like, if they're having a tough time, like just having someone to come in and talk with them about what's going on and process it with someone that's not their family and not the medical nurse or doctor can be incredibly valuable. So it's important that the patient's aware of that kind of support that's available to them, as we are as well. So anticipating what they're going to ask you, knowing what to expect. So those are kind of the questions they might ask you. So kind of being prepared to provide those answers. I dive really deep into this in my book, so I'm not going to spend a lot of time on it, but I think it's important to know those kinds of things. And like physicians anticipating their questions as well. You know, if you tell them about a low blood pressure, they're going to ask you what the other blood pressures have been. If you're going to tell them about a low potassium, they're going to ask you what the last potassium was. If they're getting any fluids, if they're drinking a bunch, if they're peeing a lot, if they're taking diuretics, those kinds of things. All right, so know what to expect when they come and ask you questions. All right, so the second one is to be prepared. Like Scar from The Lion King, be prepared. So be prepared when they ask you questions. So that means you kind of got to know your patient, right? You got to know the answers to those questions, or at least be able to find them, okay? So, you know, being prepared to answer and know what their blood pressures were. So don't go tell the physician, hey, my patient's got a low blood pressure, without having looked what they had been running, right? You want to be able to think about a situation critically, get all the information in front of you before you go ask somebody a question. You got to have all that information first, all right? So be prepared and anticipate the questions, okay? So knowing what to expect and being prepared, those are kind of one and the same, but making sure that you're ready for that. Number 3, do not refer to the patient as room number. Room numbers mean nothing to these people, okay? There's a difference between the nurse and the rest of the healthcare team. The nurse is stationary. I am on my unit, all right, with this set of rooms all the time. The the therapy service people, case managers, physicians, they're all over the hospital. They are not stationary, all right? So they follow people by their name. So if you tell them, hey, patient 62 is hypotensive, that doesn't, no, they mean nothing to them. So make sure that you're saying, Mr. Smith is in room 62. He is hypotensive. It's subtle, but it's a huge difference. We look ridiculous when we go and talk room numbers. We talk room numbers to each other because we're all familiar with those rooms backwards and forwards, but no one else in the hospital knows them like we do. We need to talk like patient name wise, okay? The next one, know your chain of command. Number 4, know your chain of command. If you're having an issue, if you need a different, if you need physical therapy to come in, but the physical therapist is busy and you got to get somebody in today, like know who to call if you need to go up the chain of command. I had to do that with physicians before when I had a concern that wasn't being addressed. Who do I talk to now? It's important to know those things when working with the other members of the healthcare team. Because if someone gives you an answer that you don't believe is safe or appropriate, you don't just stop there. It is your job as a nurse to be diligent in getting whatever's safe and necessary for the patient, not just like saying, okay, and then moving on. So it's important to be aware of your chain of command. Hopefully, you will rarely ever need to use that. I haven't needed to use it much, but it is very important to know the process, okay? And then finally, my last one, guys, is this is a team effort, okay? So if you picture, the patient in the middle and then all of these members of the healthcare team around the patient, and what the patient needs to progress towards discharge is the priority, then that makes this all make sense. It is not about somebody's task list, asking them to do more. This is everybody's job, is to help the patient progress towards discharge. So you don't call the physician and say, hey, I'm sorry for calling you. Don't apologize for calling, because you're doing what you need to do for the patient. Don't apologize to the physical therapist for putting in a PT consult. It is their job to do this. So you don't apologize for that, okay? That's y'all are just doing your job, and we're doing what we need, the best thing we need for each patient. All of us working as a team to progress this person towards discharge, okay? So kind of unapologetically, Tosh shaking off. Did you hear that? No. See, they're getting impatient. But doing what you need to do to progress them towards discharge. Right, Mac? Do you feel passionate about that? Yeah. So I'm at 9 minutes, and I want to be able to be respectful of your time. So if you guys want to learn more about each role in more detail, please check out my book, Anatomy of a Super Nurse, or Admit 1, What You Must Know in Going to the Hospital But No One Actually Tells You. Those both dive into this a lot more specifically. But those are some tips to be able to deal with chatting with the healthcare team. Stay tuned for our next video that is coming up. Excited to see you guys tomorrow, so have a great day.